Hello, my name is Patrick Odenkon. I'm the CEO for the Saskatchewan Health Research Foundation, otherwise known as SHRF. Welcome and thank you for joining us today. SHRF funds, supports, and promotes health research that matters to Saskatchewan. SHRF partners with many organizations to support health research in our province. And today we have three partners joining us to discuss the value of our partnerships and our collaborations and the importance of health research to each organization and our province as a whole. So before we get going here, like to have you introduce yourselves, tell us a little bit about yourself and your organization and the role you have in supporting health research in the province. So I'm going to start on my upper left and pick on Joanne. So Joanne, if you would like to start.
Thank you, Patrick. I'm happy to be here as part of Health Research Week. I'm the CEO for the Alzheimer's Society of Saskatchewan. We're a provincial organization that supports people to live well with dementia across our province, and we also fund research. And so my role is really instrumental in supporting research, and the direction for research really comes from our board. Our vision speaks to a world without Alzheimer's disease and dementia. And what will help us accomplish that is certainly things that we discover through research. And our mission as well is very much about supporting people to live well with Alzheimer's disease, but also that we want to fund research into prevention, cures, and quality of life. So really helping to find the answers through research, but helping people who currently have dementia to have a better quality of life. And both of those are possible through research. So a key priority for us and part of our strategic plan, and a very prominent part of our strategic plan over the next 5 years, is going to be increasing the amount of funding that we support for research and really amplifying that so that we can make better headway for people who are currently living with dementia. Another key role that I have is connecting people with lived experience of dementia to research. So that happens through research clinical trials, research studies. Definitely researchers are reaching out and wanting more involvement from people with dementia. And that is very, very important that they are involved in research, that they have a say in research. And in addition to being part of different research projects, more and more we're looking to people with dementia and caregivers and asking them, what's important to you? Not so much what's important to researchers, but what's important to you? What are the areas that you want research to go in? What are the questions that you want answered? And so more and more having people with the lived experience directing the research projects. So that's quite new for us, and I think very exciting, and provides a lot of hope for people living with dementia that they're having a say in what a future world looks like for them. And then the other part of this is definitely the letters of support, being part of research projects, and then also using knowledge acquired from research in our day-to-day programs and services. So we talk about, the information that we provide is evidence-based. So there's a lot of different ways that my role is involved in research, and it's really a very integral part in who we are and what we do as an Alzheimer's Society.
Thank you, Joanne. Next, I'll pick on Stephanie.
Good morning, everyone. I'm Stephanie Rousseau. I'm the Director of Health Policy and Systems for Heart and Stroke here in Saskatchewan. And my role here in Saskatchewan supports the research community in a variety of ways. I work with the research community to identify opportunities for health research, basically to support the conditions that we represent, including heart disease and stroke, of course, that heart and brain connection. So this also includes any potential opportunities to collaborate and partner with other organizations with similar priorities, and of course, to just drive that innovation and impact. A few other thoughts that I had on the role that we play here in Saskatchewan in terms of research. It's very important that we also play a role of the enabler to connect the current and future researchers to heart and stroke so they understand our research priorities and the funding opportunities available to them as well. And, and thinking about our donors, it's really important for us to steward that relationship between the researcher and the donor as well. That stewardship really provides that donor insight into what a difference their donation makes, and at the same time gives our researchers insight into the lives that are affected by their research in our communities. So those are certainly ways that my role helps support that here in Saskatchewan.
Thank you, Stephanie, and we'll talk a little bit more about donors and fundraising and research later on. So over to Erin.
Great, thanks, Patrick. Well, and I have to say it's a pleasure to be here with two other great leaders and organizations that are very much part of the fabric of research and health in our province. My name is Erin Kwan, and I have the privilege of being the president and CEO for the Lung Association of Saskatchewan. And really working in tandem with our volunteer leaders, my goal is to ensure that we meet our mission, which is to improve lung health one breath at a time. But we certainly do that through a variety of avenues, and research is one of our very prominent pillars that we utilize to do that. We've really embraced the role of telling the story of research in our organization. We at the Lung Association are not in the business of being the direct delivery for funding for research. We have the great partnership with Saskatchewan Health Research Foundation, which we're very grateful for now. But what we really want to be is a conduit to share the stories of success and advancement that's happening with the projects that we fund in our province, but also to connect patients and researchers. So we want to be that reliable source of information and really partnerships where we can ensure that patients not only have access to the information that can be gleaned from research, but they also have the opportunity to participate in research projects as well too. So we are a funder, absolutely, but we also really try to act as a conduit between researchers and patients and give more voice to the research that happens in our province as well.
So if you look at the continuum of research, all three of your organizations are very much from front to back, facilitating and funding the research, connecting researchers, connecting patients, having the patient-oriented and patient voice in there, and then actually the use of research. And I think that's what makes your organization so strong. So thank you for those introductions. So the first kind of question we want to get at is, within your organization, I think it's safe to say that supporting health research contributes to your overall goals of your organization. But can you talk a little bit more about how research fits in? Maybe we'll just start with Erin, since she was last to kick it off.
Sure, thanks, Patrick. I think research really enables us to, well, as I said earlier, continue on our mission path, but in order to improve lung health and prevent further lung disease, we have to build campaigns and programs and supports for patients based on scientific evidence-based research. And so, of course, this is one of the ways, research is actually one of the vehicles that informs our program direction, and really enables us to build, whether it's public awareness campaigns or education sessions, and understand what further work needs to be done in that sector. So absolutely, it really helps to inform our decisions.
Stephanie, anything to add on that piece?
Yeah, I think one key area certainly for us at Heart and Stroke and for all that we do, that research that we fund very much goes to drive the critical system change that's required. And so thinking about our people living with heart disease and stroke and that heart-brain connection, enabling change at that health system level is really at the core of what we do here at Heart and Stroke, and that health research drives that. So that was just, a point that I wanted to just touch on. And at the organization, we really just strive to be that link between those researchers and the clinicians to drive that system change. And without that linkage, we wouldn't achieve the outcomes that we're hoping for within that research.
Anything to add?
So very similar to Stephanie and Aaron, you know, research as a foundational piece that really drives a lot of the mission activities of the organization. And, you know, I think similar as well to the other organizations, we're the credible voice for people who are looking for credible information and answers. And, you know, there's lots of information out there that isn't necessarily evidence-based. And so I think it's really important that our stakeholders understand the collaborations that we have with researchers and research organizations like yourself to provide evidence-based information so they know where to turn, they get those answers, and they know that the information is credible. And, you know, for example, when you're thinking about a diagnosis of Alzheimer's disease, you know, that protocol to make that diagnosis is reviewed every 3 years. And it's only when evidence changes that we can change the protocol to make that diagnosis. And often you hear things in the media about, you know, something new that happened in research, but again, you know, that happened in one study. And so, you know, we help people to understand that that is a breakthrough in research, but in order for us to change the diagnostic protocol, you know, that information and that study would have to be replicated numerous times to make those changes. So I think as well too, helping people to understand that, you know, the evidence takes time and there's got to be a lot of credibility behind the research in order for us to change some of those key messages. So, you know, research is that very foundational piece that I think makes the difference and helps people to have a lot of confidence in the information that they get from organizations like ours.
Thank you very much for those insights. So we've been talking about partnerships and collaborations and the collaborations and what you do with your community, but also with researchers. So can you maybe talk a little bit about how that contributes to your organization's success? Stephanie, let's start with you.
So partnerships have really been at the core of what we've done at the provincial level. At Heart and Stroke, we've been partnering with provincial organizations for some time. That includes our own SHRF here in the province, the University of Saskatchewan. We've partnered to create the Saskatchewan Stroke Research Chair here in the province. And without those key partnerships, you know, I think most of us are doing more with a lot less these days. So it really allows us to drive more innovation and certainly drive more impacts in what we do here in the province. And more, I think about SHRF and the work that's been done with the Funders Forum. And SHRF has been a convener of all these great health research funders. And we've come together to look at our organizational priorities, where we can align, what are the like opportunities, what are the challenges, and really address those together to do more. And so I think partnerships are so key to what we do. We share very, very similar challenges in the province and not just related to our disease states, but outcomes for our patients. We think about our rural and remote areas, our Indigenous peoples. So they're key to our success now and in the future. One of the examples I thought about with some partnerships was this Provincial Stroke Research Chair. So academic research centers like the University of Saskatchewan are such a critical partner. This partnership with SHRF, with our Provincial Stroke Research Chair, really, we provide funding so these researchers have protected time to dedicate to research, but it also then frees up the individual from teaching and administrative duties, and certainly enhances their heart and or brain health research program. And in the case of this Provincial Stroke Research Chair, what this funding has also done is certainly driven change within the health system with this lead role. And so it's advanced stroke care here in the province and certainly expanded that. So these partnerships allow us to do more and allow us to drive that critical change in the end for our people with lived experience.
Thank you, Stephanie. Aaron, anything to add on that?
Absolutely. And I think Stephanie touched on this earlier, is that, in this day and age, partnerships are really, in our business, are a necessity. It's not a nice to do, it's a must do. And in order to, build the strength of your organization and demonstrate impact and be able to really maximize your resources, you need to have those partnerships. And one of the things I like to think about as a leader is that the best leaders really surround themselves with people that have expertise in other areas than themselves. And the Lung Association is no different in that. And that's one of the reasons we've partnered with Saskatchewan Health Research Foundation, is that you are really in the business of research investment. And we have great trust in that. And that's something that really helps us to achieve our mission, but also learn more. So not only do we have the partnership with Saskatchewan Health Research Foundation, we also partner with organizations like Heart and Stroke, and Stephanie as an example, on advocacy, health promotion, and education issues. So even whether it's in the research lane or otherwise, those partnerships are crucial in us being able to advance our work. We've also have a great relationship and long-standing partnership with the Division of Respirology at the University of Saskatchewan, and really throughout the province. And we're another pillar of our business, of course, is education, not only for patients, but for healthcare professionals. And so we rely on that, those partnerships to help us guide our work in that facet as well. Similar to Joanne, we really aim to grow our investment in research in the province over the next 5, 10, 15 years. And as such, though, that investment, or I guess the growth in that investment, is only going to be able to be realized with great partners. And that's both in the research space, the academic space, and the donor space as well.
Excellent. Thanks, Erin. Joanne, last word to you.
Thank you. And just to add to what Erin and Stephanie have said, lots of similarities. The partnerships that we have allow us to do more than we could on our own. And like the other two organizations, constantly looking for people that are aligned with our strategic priorities, that maybe bring a different lens or a different expertise to what we're doing, that helps us to achieve that goal, maybe with more expertise or quicker, or in some cases helps them to achieve goals on their own. And I think about the role of the Saskatchewan Health Research Foundation and the peer review process. So we do fund research here in the province, and we don't have the expertise or the capacity for that role. And so the partnership with SHRF really ensures that when we are funding research, that it's credible and meritorious. It's at arm's length to our organization. There's not conflicts of interest there. And so that's really, really important, and a very important aspect when we're funding research here in the province. I think about the partnership with researchers and again, the expertise that they bring to evaluation. They've evaluated some of our programs and help to enhance the way that we're delivering that program. Again, I think when you're evaluating a program and you have someone external to your organization asking those questions, I think people feel a little bit more free to talk about what's going really well in the program, but also maybe some areas that you can improve in. So those partnerships with researchers are very critical to help us to continue to improve the programs and services that we do deliver, and to make sure that they are meeting the expectations of our people with dementia and our family caregivers. Again, and I think, as others have said, just partnerships to make sure that the voice of dementia is involved in research, and that's really critical in what we're all doing as organizations as well. So, collaborating with SHRF, with researchers, with people with dementia, and other agencies and organizations. And it's really all about helping us to be more efficient and effective, and to make the best use of donor dollars to better advance the healthcare in our province.
I really like the fact, and I wanted to just add to what Erin had mentioned about the advocacy work. And I think about all of us on the panel here right now and the work that we do. And and Erin had referred to this, but, you know, we work with Lung and in our Tobacco Coalition and tobacco and vaping advocacy efforts. I think about our heart-brain connection and where now we are focusing more on vascular cognitive impairment and dementia being its worst form. And I think about Joanne and the work being done there. And just in general, for the advocacy of health research in our province and the Sask Health Research Foundation, what that provides us as organizations and opportunities and the importance of that. There's really not a health funder that I can think of that we don't have some sort of like effort that we can join forces and not just fund research, but advocate for the people of Saskatchewan.
Thank you very much for those insights. Just want to follow up with you. You know, we have the formal partnerships which SHRF would engage with you as organizations, but maybe I could ask you to discuss a little bit about you know, maybe some of the more informal partnerships of how you work with patients and the patient partnership relationship within your organizations. So Erin, would you mind starting us off on that one?
Well, that's a great and important question. And I'll try and articulate all the ways in which we engage with our our patients or our stakeholders, really. And I just top of mind was on a Provincial Lung Health Alliance workshop, a full day workshop the other day, and we had a really diverse group of stakeholders at the table in terms of researchers, healthcare practitioners, agencies. But most important was the voice of the patient. And it was interesting because the patient actually had the perspective that, oh, well, what might we have to offer as patients when we're at the table with, folks that have medical degrees and all these kinds of things. And it was really important for us to remind the patient that without them, nothing else matters. They are the reason that we do the work that we do. They are the reason that researchers work so diligently on their projects. And so I think their voice is so important in terms of advancing, advocating for care and supports in place, but their stories are incredibly important in terms of being able to articulate the patient journey, whether that's through research, care, education, all of those kinds of things. And they're a voice for other people that are experiencing that lived experience with lung disease as well. So there's so many ways that we, and reasons that we treasure the relationship that we have with our patients in articulating the importance of the work that we do, but also similar to research in advancing the work that we do.
Thank you. Stephanie, anything to add on that?
Thanks, Patrick. For sure, our people with lived experience are at the heart of everything we do, of course, here at Heart and Stroke and with our organizations. Some of the areas, maybe just to build on what Erin was talking about too, we think about our people with lived experience now joining in a lot of our patient advisory groups. So these are very key areas that we really need that patient experience and that voice as we look to drive that systems change. And I think about some of the work specifically here at Heart and Stroke that we're doing in terms of expanding stroke care in the province. And without that patient voice, looking at designing the system and architecting the system, we can't do that without the patient being first and foremost, and not just considering the patient, but having them present and guiding us with their stories and their lived experience. So that's another key area. And then just thinking specifically about, again, their stories at Heart and Stroke, we're actively involved in our FAST campaign right now, which is basically the 4 signs of stroke. And those patient stories are so key for this advocacy work. And really, it's a public awareness campaign and getting the public to identify those signs of stroke and then taking action to actually call 911. And to have that patient share that story of how that's made a difference, or perhaps even how it didn't, or where they couldn't recognize signs, has really been so key in what we do and what we do every day. So those are just a few examples to build on the very important examples that Erin has shared.
And Joanne?
Thanks, Patrick. So similar to Stephanie and Erin, certainly the voice of people with lived experience is very important. And sort of the mantra that we use is nothing about us without us. And, making sure that, people with dementia and caregivers are the center of what's happening. And oftentimes, research can be focused on, where the researcher thinks research might need and want to go. And more, I think what's common across health charities is involving people with dementia or other disease states and asking them, what are the important things that you want answered through research? And often there's similarities, but sometimes there's differences in what they feel is important in the direction that research should go. Also, and I think this is similar to the other two organizations as well, is involving people with dementia in the research process. So, identifying the key ideas, maybe participating in the research, and also now being on relevancy panels. So when research is being peer reviewed, how relevant is that research to a caregiver? Do they have something that they could suggest that, might sort of change the direction of that research a little bit, but that it would be more impactful to people who are currently living with the disease. So I think that's really, really important. And and really involving the stories. And, I think you can talk about the statistic that, less than 50% of people who have dementia in Saskatchewan have a diagnosis. But when somebody tells the story about their difficulty in getting a diagnosis and difficulty in getting their warning signs recognized and being told, well, every person forgets. And when, people who are conducting that diagnosis or that research can hear that, I think it affects them in a way that really influences the way that they can design a research study or change a practice. So again, as the other two have said very eloquently, I mean, the reason we're here is for the person, and we're person-centered organizations, and therefore the research work that we do follows that same principle.
Thank you, Joanne. SHRF partners with the Saskatchewan Centre for Patient-Oriented Research on, not only co-funding research, but even on initiatives, how we peer review and ensure that the patient's voice comes through, and on other initiatives. So obviously something that funders need to consider, and it's an important aspect. So thank you for your perspectives on that. So, in a sense, the $1 million question, and our last question for the day that we'll talk about, is a little bit about fundraising. And the generosity of your donors is obviously key as a health charity, and gives you the ability to contribute to health research and fund health research. So can you speak to how working with SHRF or other organizations helps you achieve accountability with your donors? I'll ask Joanne to start on this one.
Thank you, Patrick. So, I think, central again to what we do, it's really, in a lot of ways, when we're raising money for research, it's about the mission of our donor. And the strongest mission of our donor is, they want to change the trajectory of the disease through research. And so really it's the power of that donor and what their mission is. And a lot of them talk about, maybe perhaps they have a diagnosis of dementia, but they don't want their children to get it. And they for sure don't want their grandchildren to get it. So it's really that inspiration and hope that drives us to raise money for research and to really look at providing more hope to people. The Alzheimer Society over the past 10 years, in partnership with SHRF, has funded $2 million for the research chair in Alzheimer's disease and related dementia. And that provides a lot of hope to people. The fact that, that researcher can come out and talk at annual general meetings or go to a support group and talk directly to people about, what the impact that research will have on the future of people living in our province is very, very powerful. And the other thing that donors love is, the partnership in funding. So, when we put forward $100,000, it's matched by the Saskatchewan Health Research Foundation. And that's really motivating to donors to know that their efforts can be doubled, and that there's, again, it's another partnership in finding hope for people with dementia. So that is a really essential part of what donors are looking for.
Excellent. Stephanie.
Yeah, sure. Partnerships with SHRF have certainly demonstrated impact in the health research community and our health system to drive systems change. And that's just been so key to what we've done over the last 10 years with our provincial stroke research chair. I'll use that as an example again. And without that partnership, we would not have been able to come together to form this chair. And it just, as I think I mentioned before, it doesn't just perform that research function. The role has also been a critical enabler of stroke system change and the expansion of stroke care in the province. And so with partnerships, in terms of research funding, we can then demonstrate the impact of these roles of this research funding to our donors. And that really does create the accountability that we need on a number of levels, but really truly demonstrates how research can better the lives of our constituents and our people with lived experience.
Thank you, Stephanie. Erin.
Thank you. I could almost say ditto for what my two other colleagues have articulated, but at the end of the day, donors give because really for two reasons. They have a desire to make the world a better place and contribute to that. That's the philanthropic reason, but they are making an investment. So when you're a donor, you also approach your donation from what is going to give you the best return on your dollar, and you trust the organization to take those funds and do the best work that they can possibly do with it. So I think in terms of partnering with SHRF, that's just been good business acumen. That's just been good business practice for us to, as Joanne said, really double our dollar. So we can say, you know what, if we're investing $40,000 and we're partnering with SHRF, suddenly that becomes $80,000. And then if we're actually able to take that partnership, as we recently did, and partner with an entity like MyTax, we can even triple that or make that go further. So it's a good business investment, but we have to honor those reasons that people choose to invest in our work. It's not just a donation, it really is an investment, and we take that very seriously. And I think also having Saskatchewan Health Research Foundation in our network, or even really kind of almost on our resume, if you will, our organizational resume, shows that as an organization and a business, we are partnering with the gold standard of research in Saskatchewan. As Joanne said, it has to be meritorious, it has to be ethical, it has to be rigorous, and we want to be aligned with that when we showcase the work that we do, and that when we back up the work that we do as well. So I think there's many facets to the accountability of our partnership, but those would be certainly some of the key pieces.
Thank you, Erin. That's very kind comments from all of you about SHRF and the work that we do. I can speak from SHRF's perspective, is that all three of you are very important partners for SHRF, and it's you give us the view to the world in which you live in. We live in a little bit of a different world than you do, so we get just as much out of our partnerships with you. And once again, the accountability piece is important for us as well, being a government agency. So thank you very much. It has been an absolute honor to have three of our province's leaders in our health charities, but just leaders in our health system. You guys are involved in so many places, in research, in health services, in fundraising, and services to your constituents that I'm always just humbled by the work that you do and its importance to our province. So thank you very much for that, and I appreciate your time today.
Thank
Thank
you.
you.
Thank you.